Hello, I'm going to make a video for the non-biological treatment question and the evaluation of it that was set up for homework, just in case you need any help on it. So I've copied and pasted the information that is in the model answer booklet that's in the revision section folder of the Google Drive. And so let's have a go at answering this one. So usually a good tip is to recycle the question. So let's copy that. So we've got one non-biological treatment which can be used to treat phobias is systematic desensitisation. Which is based on behaviourist classical conditioning that shows you can unlearn a phobia. Something like that. This is not going to be perfect. This is just like, it'll get you the marks. So we can put therapists create a fear hierarchy. For example, if they feared spiders, it may start with seeing a picture of a spider, seeing one in a closed box, seeing one in a box with the lid off all the way, holding the spider in their hand. So we've got a comma there, all the way. Just put there with the client. And then put the client is taught relaxation techniques, which is an unconditioned stimulus that creates an unconditioned response of feeling calm and not fearful. This is then paired with the phobic. In fact, let's just put the unconditioned stimulus is then paired with the phobic object, such as spiders, at each stage of the fear hierarchy. Can't spell hierarchy. And the therapist asks them to rate their fear on a scale of 0 to 100. Let's just read this back. So we've got one non-biological treatment which can be used to treat phobias is systematic desensitisation, which is based on behaviourist classical conditioning that shows you can unlearn a phobia. Therapists create a fear hierarchy with the client. For example, if they feared spiders, it may start with seeing a picture of a spider, seeing one in a closed box, etc., etc. The client is taught relaxation techniques, which is an unconditioned stimulus that creates an unconditioned response of feeling calm and not fearful. Unconditioned stimulus, let's put the unconditioned stimulus is then paired with the phobic object, which, but let's just put there neutral stimulus, such as spiders at each stage of the fear hierarchy, and the therapist asks them before moving on to the next stage of the fear hierarchy. Eventually the phobic object will become the condition where, conditioned stimulus and create the conditioned response of calm. In fact, what I might do is I might integrate that in actually. So I'll put that there. Yeah, get that. There we go. Let's just see if I've got everything. There is a little bit that you can talk about with the Yerkes-Dodson curve of arousal. So that's like the reason why the anxiety exhausts itself, but you don't really need that, to be honest. Right, so we've got an answer there for that. Now, in terms of evaluating it, if it's a 5 marker, you want kind of like a strength and a weakness. So let's see, usually something like it being effective and things like that, or not being effective. I'm trying to think of what might be a good one. Because there's lots of things you could say. You could say things like, because it's a standardised procedure. In fact, I'm going to go with that. As this treatment has a standardised procedure of creating a fear hierarchy and pairing an unconditioned stimulus with the phobic object until they unlearn the phobia. So I'm just kind of like summarising a little bit of the AO1 knowledge to get that in there. Just creating a bit. I might put neutral stimulus in there. I can't actually do that because I haven't said what it is first. Unconditioned stimulus. For many patients, and therefore reliably will treat phobias. So as this treatment, a standardised procedure of creating a fear hierarchy and pairing unconditioned stimulus with the phobic object, neutral stimulus, spell it right, until they'll unlearn the phobia. It means it is replicable for many patients and therefore reliably will treat phobias. That'll get you probably 2 marks because it's not very, although I suppose we've got standardised, we've got replicable and reliable, and it's in context, probably 3 marks actually. And then can we do another one? We can go with the fact that this is only good for a specific phobia, not for like a social phobia. If you've got a phobia of dying or something like that, you can't really treat that. So we'll put, however, this treatment, or could we say that it's reductionist? I mean, you could argue that it's reductionist, which means that maybe they've got a phobia for a different reason, or maybe they've got a mental disorder for a different reason. Maybe you could say that this, although it does see the question says one specific disorder, so you're going to have to stick with phobias. What I was going to say is that Behaviourist is only really good for phobias. It's not good for depression or for schizophrenia. So if you had the option to say other disorders, then you could use that point. But anyway, let's go with, what was the other one that I said? However, this treatment, what did I say? Oh, that was it. Doesn't work for a non-specific phobia. I was like panicking, and I was like, what on earth was I going to say? So anyway, however, this treatment may not. In fact, I'm just going to put, rather than this treatment, I'm going to put systematic desensitisation just to link it to the question. So for all phobias, as there needs to be a specific object for it to work. For example, it may not be practical to treat someone who is phobic of, maybe it's not good to put death, because obviously that's a bit ridiculous. Is anyone phobic of death? I think we're all scared of dying, aren't we? What could you be phobic of that you couldn't really practically do? Maybe if you were phobic of maybe flying, but then flying is a specific object, isn't it? But then that would be like impractical because you'd have to take them on a plane, so that would be quite difficult to use. That'd be a separate point. But I'm trying to think of something that they could be phobic of. Maybe to treat someone who is phobic of social situations, maybe. Maybe perhaps treat someone who is phobic of social situations as you could only role play this, or the therapist would have to follow the person, the patient. No, it's not a great answer, I'm going to be honest, but it would pick you up some marks. So we've got, just to make an example, we don't practice treat someone who's phobic of social situations as you could only role play this, therefore it is not practical. It may not work at treating the phobia. Yeah, it's not great that, I'll be honest, but let's see. So we've got systematic desensitisation, standardised procedures, so that's 1 mark. Unlearn the phobias, replicable. Reliably treat phobias, that's 3. Might not work for all phobias, need a specific object to work, got 4 marks. And then might not be practical, yeah, it'll get you 5 marks. The other point that I made before about maybe I can't remember what I was talking about. There you go. There's an example of what you could write for those. Oh yeah, the reductionist point, that was the other one, wasn't it? So you could maybe bring that in. Maybe it might be due to something else, like a bad experience that you've had that's got nothing to do with, you know, the actual pairing of the stimulus and response. So you could kind of go into that a little bit if you wanted to, a bit more difficult, but you could mention that. So hopefully that helps. Hopefully that gives you a better idea of how to answer these questions. Any other questions, just let me know.